guys. Thanks for joining us this afternoon. We're going to be a little more casual this afternoon than we were for the morning, so let me just give you a little update on what we have this morning. We had invited district teams to come and listen and experience implementation science and what that means. And I think we had those that were here for the morning. I don't know if you want to comment. I think we had a great turnout. We had good discussions, some really good questions that came up. Dr. Fixsen talked a lot about the point of entry is the district, but then how do we grow? So I think our conversation this afternoon can be, because I actually got a question from one of the districts, what's our role at the UPDC and at the state office, and how do we support some of these pieces? So I said, I'm going to kind of echo what Dean said, which is the point of entry is a district, but we still need to grow as a state. We need to figure out how to align and move forward in those pieces. So I think that that's part of our discussion today. We started this discussion, and to just let Dean know, we started this discussion in the fall. In November, we had a meeting where we talked about moving forward in our state with a multi-tiered system of support. We wanted to make sure that we had these key stakeholders on board and what that needed to look like. And there was some interest in having a couple more follow-up conversations. So this is one of those opportunities. We're excited about that. We shared a couple of the briefs that Dean has co-authored, so folks are familiar with those. And I think in some capacities, folks are probably more familiar in this group with your work than probably we have this morning. I think people are more familiar with that. So one of the things I had made...
You have to ask easy questions.
We made copies of the synthesis of literature, and I think this morning folks loved them so much they took extras back to their folks, which is totally fine. So any of you that I see more often, if you want to hand yours to someone else that I don't see as much, if you don't already have one, and then we'll just get more copies if those of you that don't have it. It's a free download online, but as Dean pointed out, it's nice when the colors.
Yeah, if we can share it between us, that was wonderful.
So he doesn't usually get to see the colors, but when we print it so nicely, so then we can just make sure we have that information. So when I asked Dean to talk with us, we knew we had him all day. It made sense to just have districts for half of the day and then talk about some state issues and how can we use this information and align and just have a good discussion. So it really will be more of a discussion. So if it makes sense to you, we talked for just a second about what we wanted this afternoon to look like. We could come up with some guiding questions to start, or we could have him present on some information and see if that guides some more questions. I mean, this is a really open opportunity for us to just problem solve and talk as sort of a state level collaborative team. We had planned on having the conversation until about 3, so we have 2 hours together. So are there preferences? Are there things that you feel like we really want to touch on? Yeah.
I think perhaps you might want to know how familiar we are and
Great.
how we've been using, because actually Dr. Fixsen's work has been core and central to a lot of the school improvement grant schools, the 6 schools that we've been working with, through guidance from our SWCC and from Ed. And so I know he's familiar with that whole process, and so I think it'd be interesting for him to know where we are in the process of using the materials that he's
So one thing we need to clarify up front, that I'm Dean. So the only people that call me Dr. Fixsen are the ones trying to date one of my 4 daughters. Most of them are married right now, so you only have one choice, if that's what you're after. But so otherwise, if you call me Dr. Fixsen, I know you want to date my daughter. Otherwise, I'm Dean. So you get to choose.
I got that chair for you.
I know, but if I sit there, I may not participate in the last 30 minutes of this discussion.
So we'll maybe start with kind of where we are and how familiar we are with his information and the implementation science. That's a great place to start. I think one of the pieces that I've heard a lot but really resonated with me this morning is also the HIT and PEP process and how that relates to a state team.
So the whole practice to policy feedback loop.
That feedback loop, the practice to policy feedback loop, I think is really, I've heard it a lot, but I think even in this context would be really helpful to talk more about that. And I'm sure more things will come up. Anything right off that you, good suggestions, and we'll just go from here and see what more information we get. Okay, so I'll start a little bit. Yeah, go wrong.
I don't know how familiar you've made Dean with the whole ABCDBI process. I guess I would just be interested in
what that looks like?
Perspective on
Okay.
ABC.
Not familiar, as you can tell.
CBI.
Yeah.
UBI.
UBI.
Heidi, I think it'd be helpful to introduce everybody too.
Okay.
Yeah.
Okay, so let's start with that. So I'm Heidi, and I know everyone in the room. Part of the UPDC, and one of my responsibilities the past few years that I've been here has been, I guess, really the project coordinator of the ABC UBI project. And Dean has been out to our state a few times before and was familiar with some of the previous state team members who have since gone on to Canyons with Holly and Amber and so that kind of
Yep.
work in the schools. That's what that project is. So you're probably a little more familiar than you actually realize with that project. The project is largely funded with state professional development improvement grant monies. We're in our 5th year, which means that's ending, and we are waiting for the RFP to come out in May for the next go round, which is why we had started these conversations. How do we scale up now that we've learned about PBS and RTI, and we have these participating districts, and we have, just like you talked about this morning, Islands of Excellence, some really great schools doing some really amazing things, but we found our capacity to grow has kind of flatlined. We train a few schools and they work with us and they graduate. We get just a couple of more schools, but we really haven't been able to go to scale because we need to work more at that district level of implementation. So that's what we've been trying to focus on with this next go round of the SIG grant, which made sense why we need key stakeholders involved in having those conversations. So that's kind of where we are, and that would represent the UPDC staff in the room, kind of how we're looking at implementing multi-tier systems of support. So, other introductions, I'll let you guys, you want to speak into your loud teacher voice?
Yeah, thank you. I'm Devin Huey, I work at the UPDC and I'm on the state UBI. We have TSS team.
Lots of initials.
Yes. I'm Rob O'Neill, I'm the chair of the special ed department at the University of Utah. I'm the advisory board for the
Let's make a suggestion to do that.
That thing, yeah.
What is the difference?
I think so, too. This configuration is awful.
State Department of Education.
Special ed.
We could actually
Yeah.
Special ed though, okay.
just pull those desks. I can go do it after.
My name is Ann White. I'm the Title I coordinator from the state of Utah, specifically in school and district improvement, SIG grant, schools and improvement districts and improvement investment.
You get to have all the fun.
We do. Along with my partner and colleague.
I'm Becky Donaldson. I work as a specialist in Title I school and district instructional improvement.
Sharing the fun, all right.
Sewer. How can you say my name? That sandwich was so good. It's Sue O'Croy, and I am the early childhood specialist for the state office. I'm not sure why I'm here, because I don't have anything to do with this grant, but I got the email, so I'm willing to learn.
I'm glad you're here.
Thank you.
Did you guys get some of the recently handed out early childhood funding from the feds?
No,
No, okay.
no, nor do we have any state money, so,
Well, that keeps it even.
yeah.
That's good. We like equality.
Right.
I'm Marty Kelly, and I'm the state coordinator of adult education and GED testing services at the state office.
Adult education.
I'm Leanne Hawk, and I'm a faculty member in the Department of Special Education at the University of Utah, also the evaluator of this SPDIG grant.
Well, evaluate.
I'm Brita O'Keefe. I'm also new faculty at the University of Utah. And I've worked with some of your biggest fans, George Sugai and
Oh, yeah,
that
yeah.
crowd, so.
We know a little bit about them.
Yeah.
So that ties you in some way with PBIS then?
Yes, yes. I'm kind of the literacy assessment person at the U, so definitely RTI and TSS and teaching all the students the way
Good.
to terms.
Peggy Milligan, State Office of Education, Special Ed.
All right.
Glenn Dyke from the Utah Personnel Development Center.
That one I know. All right.
And I'm Jerry Rigby, Utah Personnel Development Center. And I actually had the privilege a couple years ago
Dean being in Ogden with you.
Yes, I remember that.
So-
I remember Jerry Rigby, Eleanor Rigby, we had a whole.
That's right. I have a niece that's Eleanor, but not me.
Who gets a lot of attention, no doubt.
Yes, she does. Yes, she does.
And I'm Jenny Egan, UPDC.
Let's see.
Michael Herbert, UPDC.
Michael? Anybody else lurking back there?
Nathan, yay.
Doesn't speak.
We already know him. He controls everything.
He
So,
does.
let's see.
So I think,
You want this? I just knocked a little.
It's available, but it's just moving.
so we want to speak just a little bit, thank you for introduction, about and you had mentioned the work that you have used of Dean's and what that, or Becky, I need to speak up, or I need to stand up, okay. So can I share the microphone with you, and will you guys talk a little bit about how you're using some of this work with Title I and school improvement? I think that would help bring us all up to speed. Take your soda there.
Don't knock over the big ball.
Right.
I had the opportunity to hear Dean speak, I think it was last May in Denver at one of the
Oh, yes.
regional school improvement grant conferences.
That was a lot of fun.
And it was just a fabulous presentation, and I had been interested in his work for a long time before that, but had never had the opportunity to hear him speak. So it just resonated with me. So I downloaded the
Monograph,
synthesis and found some of your other articles on the web, and looked at a bunch of your stuff and just read up on everything, looked at some PowerPoint presentations that you have posted. And it just resonated with me to the point that I came back really excited and talked to Ann and our director,
You didn't come to
Carl.
Chicago, so I hadn't heard a chance to, we had to split and go to two different SIG conferences, so.
And I had formerly been the state Reading First director, and so this whole implementation thing was just like so passionate to me. Because you could just see in schools where implementation went well, they were getting some results, and in schools that were just like piddling around with it, you just want to strangle them. They were wasting time and money, and kids were still not getting what they needed.
I'm not sure strangling is on the
Yeah, well, it
approved
wasn't on the
intervention
approved
list.
list, but there were times we wanted to do it.
It may be evidence-based, but.
And even
So-
before Becky went to hear you in May, our Southwest Comprehensive Center had done a
Yeah, they've done some
webinar
things
with Mary
with it.
Peterson
Uh-huh.
and Marie Mancuso, Paul Kohler, that group, and they had introduced us to a wider scope of your work too. So even before she went we've been introduced by our.
So
Southwest
based on
Comprehensive.
some of your articles and the synthesis of the research, we put together some presentations, which I presented to our Title I directors last spring, about a year ago. And they were just fascinated with that. And since then, I've had, several districts and some charter schools that invited me out to their districts and schools to present that again. Because they said, this is the missing piece. We start initiatives, we never fully get through those important steps and stages along the way, and then nothing really comes of it. So we are just, as I said, very, very passionate, especially as we're out monitoring our school improvement grant schools right now, and looking at, how things are going. It's so important to the work that we're doing. So we're just thrilled.
She also presented to our SIG principals and
Yeah.
district liaisons.
Very good.
The whole piece. So she not only Title I directors, but all of our SIG schools and principals. We have 15 SIG schools in the state of Utah with
15?
15.
Wow.
And that's how many priority schools we will have if the ESEA flexibility waiver goes through. We were given the flexibility there as part of the flexibility waiver. Choosing the priority schools, they could be the already identified 6 schools. Percentage-wise, 5% would be 14 in the state of Utah, and we had 6 schools. It made sense to do that. And then on top of that, there will be an additional 10% for the focus schools. But all of them will be involved in the implementation of the plans that they write.
And the waiver has already been asked for and granted?
It has not been granted yet. We're one of the 28. We've had conversations with the Department of Ed. Glenna and I serve on that committee. We had I think, a very positive conversation about our grant proposal just a couple of days ago, or was it yesterday? I don't know, the days are running together for me, but anyway. Recently, and it was David Harmon and his group from the Department of Ed. He represented the peers, and so they had some specific questions, and we answered those as a group. But we're feeling very positive. What they were asking us for were very minor details, and so we're quite confident that that will come. We hope sooner than later, but we're thinking perhaps in May. We're hoping that we'll know.
It's so nice this time around that they're going through the exchange, rather than just saying your application came
Exactly.
in,
Right.
denied, accepted, take it back, guess
Right.
why.
We've had a lot of conversations also with CCSSO. They're providing some peer
Good.
reviews, and both Glenn and I have been in on those conversations, and they seem to be very positive. Do you want anything you want to add on that one?
Very good.
Here.
The only thing I would add, the only thing I would add is they have been very positive, and special education has been very lucky because the peers have not picked any component of the flexibility waiver about special ed to focus on.
So you have nothing to revise.
Not yet.
Would anyone else like to add their level of familiarity or projects they're working on that encompass some of this work before we kind of jump in? Okay.
Could
Yeah.
you just clarify the difference between SIG and SPDIG?
SPDIG, yes. So this SIG stands for, remind me what it stands for.
School improvement grant.
School improvement grants, and the SPDIG,
Title I or Title I?
so through Title
They're
I.
all Title I.
All Title I. And then SPDIG is the State Personnel Development Improvement Grant, so.
And many of our SIG schools use
Yeah.
the work that you're doing.
Right.
Many of them are using UBI, and we're making note of which ones are doing
And-
that, and they use the ABC model, so when you're.
So it makes a lot of sense for us to have to have these conversations. So
Absolutely.
that schools can get the same message. I didn't look at the numbers this morning, but last time I checked, about 33% of the schools we had been working with were Title I schools. So, and as we talk about how to go to scale in a district, it just, makes sense that we know the language that Title I is using and how can we, school improvement is school improvement. I think that that's the bottom
And every school has something
line.
that they can improve.
Right.
There
Yeah.
isn't a school anywhere in the state that doesn't have some area that they can
Of school
improve.
improvement.
So when we go out and do our money, our schools, and ESEA flexibility will be very similar to the current program now. The only schools that will have any kind of requirements or sanctions are Title I schools. All the other schools kind of get a home pass free card, except it's just made public. I don't know what else I want to say about that, but we do collaborate very heavily with special education when we do our summer conferences and institutes. Janet Gibbs works very closely with us in planning and producing those. We're going to be assisting with the early childhood one in November.
Right.
Because it just makes sense that we try to break down those silos that we've had for so many years. Parent involvement is parent involvement, school improvement is school improvement, and how can we all support one another in what we're doing.
How many schools are there in Utah altogether?
Total?
About
It seems to me about 1,000.
1,000 schools?
I think it's
Is that what you would say?
I think it's just over 1,000. but
Just
barely.
over, just barely, just under.
And how many districts?
Well, district's 41, but then you have 80 plus charter schools.
There are 88 charters.
88, the number changes all the
Right.
time, so I can never keep that perfect in my head.
Ish.
We have 275 Title I schools. Hence the percentages of 14 would be the lowest 5, 28 total schools would be the next 10%.
And is it still the case that most of all of the population and therefore schools are on like this side of the mountain, up and down the, well, Colorado, we call it the Front Range. What is this, the Back Range? I don't know.
Wasatch
The Wasatch Front, okay.
Many of them, but we also have a lot of rural schools.
Yeah,
Some that
so
are-
I mean, you still do have the.
We still do have many that are
Yeah.
rural.
Majority of our,
The St. George.
yeah, majority of our
Watches
population
parents.
Yeah.
is still West Central.
Yeah, St. George is actually a town, so. I got to stay overnight there once, so.
It's a nice place. So Becky and I actually are on the road right now doing the monitoring of our schools. We leave Sunday for San Juan, so.
And so when you do monitoring, what are you looking at or for, or
We look at leadership.
leadership?
We talk to the teachers to find out what their implementation levels are. We do classroom visits at least once a year in all of the schools.
And you have a protocol for your classroom
Yes, we
visit?
do. We do. We have focus groups with teachers, parents, students, so that we can get a flavor from all of those. We actually did not devise our own questions. We use Ed's monitoring tool so that when the Department of Education comes out to do the monitoring, they will be familiar with the kinds of things that the Department of Ed is looking for. So we use their protocol.
Is it a useful one, in your opinion?
I believe so.
We're among friends here.
You know,
The cone of
yes.
silence is over us.
No, I believe that it asks a lot of the questions. We add the classroom observation piece, and then we also look at the data. All of them are required to report to us on a quarterly basis. Excuse me, we have an electronic tool whereby the schools can put their plans called Tracker. West Ed developed Tracker, and you may be familiar with that. So we use Tracker, and then we also have, we have hard copies of some of the evaluations, but there are filing cabinets within Tracker that they can scan and electronically put their documents and their progress on a quarterly basis.
Oh, so these are quarterly monitoring
Yes.
visits? Quarterly.
No, our monitoring visits are
Okay.
biannual. We do one in the fall, one in the spring. But the reports, the school reports, the LEA reports are quarterly.
You know, one of the things, the only reason I was asking the questions about the monitoring is that part of what we are always looking for with respect to implementation, scaling up, any of these things, to what extent are things already going on in the school, in the district, in the state that are pretty darn good? And with a little bit of either use of the information that's coming back, I mean, if you're getting good sensitive data out of all of this, to what extent then does that inform action planning from one quarter to the next or one visit to the next? So you can actually do progress monitoring, if you will, for schools and districts in the same way that we would think about for kids. And some states have something that is more flexible, more attuned to that kind of use of the information for action planning. Other places, they have the thing that they just spent, I was telling the story at lunch, they just spent $15 million for their new upgraded statewide data system, but it is so totally inflexible. There's not one new thing that they didn't think of 3 years ago that you can add tomorrow. They'd have to redo the thing. So, I mean, here's this wonderful potential resource that is actually an impediment.
Ours are very flexible, and we encourage fluidity in their implementation, the use. If they're finding something that's not working, go in another direction, come a different way, they can make those changes as frequently as necessary. And so the tracker tool itself is very flexible, and we are very flexible in supporting implementation changes as they move forward.
Good.
And they have done so.
Yeah. Well, one of the things that people often say is that our system is either so inflexible that we can't make use of it, or we get into doing the work and we find that to do the work at the school district level, we need to be very nimble. We need to be able to adjust pretty rapidly to the changing circumstances in those schools, and changing in a positive way, changing sometimes where you've really tried hard and it's fallen off the cliff. But if we have to be nimble, then the people around us have to be equally nimble or support our nimbleness, if there is such a word, in one way or the other. But that's where what are the current state systems around these things? What do the communication patterns look like? How sensitive is that to some of the things that might lead to the positive change? But getting this stuff to fit together is just a continual theme, I guess, for the last 7 or 8 years for us at the federal level and every state that we interact with, is that the left hand just doesn't know what the right hand is doing. You have all this monitoring, you have all this TA monitoring information, doesn't go to TA information. I mean, what's the point here, folks? And so if you can spend hundreds of millions of dollars here and more millions of dollars here, shouldn't these things be interacting with one another? Information you collect feeds here, and what they do is evaluated by the impact. I mean, it just makes a lot of sense. But so it's the taking the resources that are currently in the state, seeing to what extent that they are already useful enough, and maybe you could make them a little bit more useful. But to the extent that they are siloed so thoroughly, you really have to tear them apart before you can put them back together again in a way that's actually going to be useful. But when people say, where is the money for implementation, scaling up going to come from, we say it's going to come from stopping doing the things that are not functional in your system right now. Stopping doing things is every bit as important as creating this new capacity. But getting people to, it's fascinating to watch the angst that's there. Adding one more thing, hey, we are all about that. I mean, bring it on. We love innovation in our school, our district, our state. Okay, and if you have this innovation, as George the guy says, for every new thing you start, you stop 2. We have to stop 2 things? Well, what's 2 things would those be? Well, the things that are, A, harming kids, if you find those, stop those tomorrow, and B, the things that are ineffective, and you have a pretty broad range of choices there. But to stop something that we've been doing in our system, our school, our district for all these years, but once they do this one time, start to see, then you get the train moving. You know, it becomes easier the next time around. But it's kind of shocking the first time. But why persist in doing things that are not useful? I mean, we have DSM-4 classifications for people like that. We don't quite say that in some venues, but here I feel safe.
What's nice about this particular tool is it is available to every LEA in the state of Utah. It's just that most LEAs have never turned the planning side on. We are requiring this year our 6 schools to utilize that planning because it lends to the fluidity with the goals, the strategies, and the action steps. And there is an update that will be coming in June that will add a budgetary piece. You say you have this goal, this strategy, and this action step, how much money are you planning on using, and where is that money coming from? That will be added in June as West has updated the tool. But it is available for everyone.
What's it?
It's called Tracker. Most districts use it as their required desktop monitoring instrument. And so it's DMI, but there's also a planning side that is the tracker that we use.
Another thing that we were talking about, well, I don't know.
No, go ahead.
That we're talking about this morning, and got a lot of audience chatter going on about this, was that, and I tend to make kind of categorical statements just to get people's attention, but and this was one of them, but anything that you're doing one school at a time is a losing proposition. You really need to go in at the district level, because it's districts that have to be there to support what the schools are doing. So one school at a time, eventually you're going to bump into the district, and when you have 3 of the 9 schools or whatever the district has that's trying to do, this new literacy program or whatever it happens to be, it starts causing these little ripples. So rather than waiting for the district after the fact to say, well, okay, we think this is okay, and I guess we're going to support it, more or less enthusiastically, or, gosh, we didn't know this was going on, we think you should stop that because those resources need to be directed somewhere else. So rather than waiting for that day to come, start at the district level. Have them identify what it is they see as the critical issues within the district, and then start building their capacity to help all the schools. I mean, not starting with all, but starting with 2 or 3 that would have wanted to do this anyway, as on a school-by-school basis. But the whole point is to really use the school change as the opportunity to build district capacity. Because once the district capacity is there, then you have a capacity that is generalizable beyond this one thing you're trying to do. You can use it for the next 5 and the 20 that are there 10 years from now, we don't even know about it. So, but that, when I brought that up, there was a lot of little chatter in the room about that, and it seemed to be mostly in favor of the idea of having district be the point of entry. Yes, ma'am.
As you're looking at building capacity, one of the struggles that we've had here has been with charter schools, with them increasing about the rate of 10 per year, and most of them are single-site charter schools. So we're also having the issue not only with building district capacity, but with charter school staff turning over frequently and having to start all over. I was wondering what you've experienced.
How is it in Utah in terms of how much charter schools report to the districts in which they're located? Not at all. This is the problem we run into. So here we have these isolated schools. Who do they report to? Who is responsible for helping them? And it turns out in some states, it's only the State Department of Education. I mean, there is nothing in between.
That's the way it is in our state.
Is that the way it is here? And so there we go to the State Department of Education and say, you and your wisdom have created the charter schools. Here are the issues that are arising. These are now your teachers. These are now your principals. These are now your outcomes. And so what do you plan to do about that? Because they don't have any district to hand this off to, because now they are the district. Now, when they are approving charter schools, often they don't understand that part. They're handing it off to somebody else, and it's going to all be wonderful because it's free of all this ugly public education stuff. And, well, public education also comes with supports, and they don't pay attention to them. Now, even when some of these are like the Edison schools, or I don't know, there's a company that is running all of this stuff. But if the schools are doing poorly, you still, where do you go with any of those issues? And that gets complicated then with state contracting, and I don't know. Fortunately, most of the states in which we're working, they do not have many charter schools. Our goal, and we say this to our charter school partners, is to create a public education environment that's a free, public, and effective education. What's there? I like
Free and appropriate.
Free and appropriate. I knew there was another one in there, but we're putting effective in there because if public education does what public education is quite capable of doing, there will be no need for charter schools. Now, we'll always have private schools for the rich and famous and all of those things, but I don't really count them as charter schools. But these are supposed to be alternatives to our bad education system. And so it makes a statement about where we are. But in 5-10 years, where we want to be, maybe we will have no need for that. And to the extent that we make the State Department of Education responsible for the decision that they have made, I have a feeling that the number of charter schools will not increase at a rapid rate because they don't know what to do with these either. So North Carolina, I know, is starting there's a limit for a long, long time that no more than 100 charter schools in the entire state of North Carolina. So they had 100, but now with our new fiscally conservative legislature, they have decided to just open the doors. So now we're going to have 2-3 times that number probably a year from now. So I am just totally fascinated with this whole process, and I can't wait to see what happens next. So, but in the meantime, we have a few thousand other schools to deal with, so we're not worried too much about them. But it is this. where does the support come from? And when problems arise, who do you go to? And right now, it is the State Department is the only responsible body that we have found in most states.
If they accept Title I dollars, they fall under the same sanctions and responsibilities and requirements of any other Title I school. And so we currently have 2 charter schools that are in improvement status right now. One's a high school and one's an elementary. But the charter schools do have the option of saying, don't want any federal dollars. And if that happens, if they say we waive it, then they don't fall under our purview at all.
Yep.
They still fall under ours.
Yes, they would still fall under Glenda's.
But I don't.
Glenda can handle them all.
I delegate my authority.
I only know enough about charter schools to be dangerous, so I don't know enough about I just know that creating alternatives like that speaks something about the current system. That's what we do know. When people start trying to find a workaround, and charter schools being one of those things, you know there's something wrong at the core. And it's really the core of public education is what we are really devoting ourselves to, because so many capable, smart, motivated people in education. So more than any other field which we work, I just see the possibilities in education as being quite astounding for making fundamental change in very, very positive ways. The big problem in education is it's so huge. Child welfare, you have 500,000 kids in out-of-home care. Well, across the country, the difficulties associated with that in terms of some here, some there, but education, I mean, think about, you know, on any given school day in the United States of America right now, 1 person in every 5 is in school. 60 million kids, 6 million teachers and staff. I mean, that's a chunk out of 300 million people. So you figure 1 person in 5 is in school. So anything that goes on in society goes on in school. Anything that's a problem out there, it's a problem in school, because 20% of us are there every day. So, I'm sorry.
In Utah, it's 1 in 4.
1 in 4.
We have the largest school age population.
Is that right? Well, even more so than. But so, as a reflection of society, a little microcosm of all the things going on in society, all the debates that go on, guess who gets to participate? It's education. So, but in the midst of that's where many of the things around implementation, getting that strongly built into schools and districts first, and then work our way to schools and regions and the state. So those things that we are deciding actually can produce effective educational outcomes. We're doing it fully. We're doing it with fidelity. We are achieving the promise of those interventions, of those instructional practices. But when those things start to happen, and then we have the feedback loop that Heidi was talking about, from the practice level to the policy level and back again, and getting that systems change cycle in place, I think there would be a way of dealing with many of the social issues that get visited on us from our participation in society. And that is not a bad thing. I mean, these issues need to be dealt with some way or the other, and everybody's voice needs to be heard. And you always have legitimate concerns from people, and sometimes you have legitimate concerns that compete with one another. You can't do this and that simultaneously. So where else is this going to be worked out? But this should not be worked out at the level of the teachers, which is the trouble right now. All of these things get passed on to teachers, and teachers are the ones that are saying, hey, you know, I'm trying to be busy teaching these kids and not dealing with all of the rest of the ills of society. And this is where the unions and the other folks are just so happy when they really get into the scaling up, implementation scaling up things in our states, because they say, oh, you mean these are issues that are going to be dealt with over there. By the time they get to us, we'll have some clarity about that. You just go for it. Take it off of our plate and put it on to yours. And we're going to get support for doing the work that we want to do as teachers, finally freed up to do what we wanted to do when we graduated from your program at the university. Bring it on. I mean, they are ardent supporters, so it is a pretty neat thing to see. But it's, here we are in the midst of this, but no wonder education has so many difficulties. It's because, I mean, this 1 in 5 thing was stunning when somebody did the math and say, you realize, and 1 in 4 is even, I don't know, better or worse. So, but I'm sorry.
Oh, I was just going to say, would you mind speaking a little bit to, I'm not sure how familiar folks are with the CISEP group and the states that you've worked with, and we touched on in the end of our last conversation some of the lessons that you've learned from those states and those state implementation teams and how they were really able to make progress. You're moving more quickly now. Would you speak a little bit about that?
Good prompt. So the state implementation and scaling up of evidence-based practices program. This is a title given to us by the federal government. Just so you know, we did not make this up. We had a different name that was kind of neat, but anyway, here we are, CISEP, CSAP, I don't know. People think of us as some kind of an oozing skin disease, you know. But we try to get past that. But our purpose is to infuse the implementation science part of this into our scaling up states, and then to help them build the capacity, really build an infrastructure for implementation to allow them eventually, and eventually being 4 or 5 years, to get to the point where they can reach every child in every school in the entire state. So all districts, all schools, all classrooms would be the recipients of this. So that's the goal. Ambitious goal. We didn't realize how ambitious, because here we were, a couple of psychologists coming in with some knowledge about implementation, pretty much ignorant about schools and education, which is why we have Rob Warner and George Sagai as our partners and teachers about teachers of us about the education system. You said what? You promised how much? So anyway, we started out with 6 scaling up states. We had resources actually to work with 4. If you count up our FTE that's left over after all of the other things coming out of our, we get $1 million a year. Subcontracts go here, subcontracts go there. And so we have 2.64 people to do this work, okay? There's some volunteer hobby time involved in this.
Yeah, we do.
So anyway, we cut it back from 6 to 4 right away, thinking that even that was a little bit of a stretch. But and of our 4 states, Minnesota and Oregon are still with us as active scaling up states. And so there we are in the 3rd year, really, of doing the active work of helping them build implementation capacity in their state. The first thing that we noticed, and we went in at the state level, so we had agreement from the state management team, the appointed elected state superintendent of schools and his or her cabinet. We spent time with them, and we spent time with the state key stakeholders at the state level. So that's where the unions and the advocacy groups and the superintendent and principals associations and so forth came along there. So having gone in at the state level, how then do you start this? And as I was saying earlier, I was stubborn about starting this at a regional level. So we invested about 1.5 years in that before I finally had to give in and say, this is not working very well. So for the last year, we shifted then and said, okay, let's go to work at districts. And now things have really taken off. So lesson number 1 was, district is a place to start. And from the district, so building the first implementation team in the district, and we chose 3 districts in the first, as our first examples of this. And each of those 3 districts we chose, and there's a whole process for doing this, 3 schools. so in each of the states. So once we got that little approach under our belt, things have really taken off in the last year. So from the district level, building the district implementation team, but this is kind of new. Who are these people? Where are they coming from? So we kind of had to sort that out and kind of incrementally get the time of 3 to 5 people at the district level to go at the school level, and then in those 3 schools started immediately working with teachers and started then seeing the first outcomes for kids that way. At the same time then, from the district level, working our way up. So now we have, from the district level, those people who have distinguished themselves as excellent implementation team members. Well, now we have our first example of a regional implementation team that's actually functional, as opposed to me trying to force this into the system stubbornly and fail at it. But now, working from the district level up, we have candidates that have already proven themselves, and we're able to do that, and we still have the state team that works. So starting the district allows us to go both ways pretty quickly. In North Carolina is our newest scaling up state. We have a readiness group that we've been working with, states that didn't quite make it the first time around into our pool. And we've been working with them, or the willing ones out of that, for the last couple of years. And so North Carolina is kind of our first graduate out of the readiness group, and now they are, as of last October, now an active scaling state. And so for them, what took us 3 years to do in our first group of states, we are going to be done with that in the first 9 months in this state. Because now we know what to do. We have a different approach, start at the district, work both ways. We now have the protocols that we have established. It took us a little while to learn where in this can we fit the implementation part and have it work with all of these teams and other things. You guys have a team for everything in education. So where could we start finding, the like-minded people, and some of this from your group, by the way, that it's general education and special education. Who's working with the problem children in our children schools district, is what I really mean, in the system. Because there you're doing things on purpose, and anybody who's doing things on purpose, you're doing implementation work by whatever name. You cannot help it. You're always doing something to bring about positive change in those districts and schools. So finding but now we have a sense of how to pull this first implementation team together, where they might come from, what to look for. So that time period now is shortened up considerably. Going to work in the district, we now know a lot more about how an implementation team can function in a district vis-a-vis schools. That time frame is all shortened up. We have a whole series of measures now of implementation team behavior. How good is this implementation team? What is it that they are excelling at right now, and where is it that we need to help them become a better implementation team? Well, we now have some very practical assessments that we can apply. None of this was in place 3 years ago. We had to create this, so it's not like we wasted our time totally. But now, to think that we can take 3 years worth of work and do this in 9 months. So in North Carolina, by the end of this spring term, we will have our first at least 2 and maybe as many as 4 district implementation teams formed and beginning to function. So by the time next fall rolls around, they're going to be ready to rock and roll. So, squishing the time down, having the assessments there, and because we're able to get there quickly in North Carolina, we have a much more engaged state management team. We have a couple of those already, Oregon and Minnesota, but we have 2 states that are no longer with us. So Illinois being one of those, and Michigan being the other. We went there, we had our one meeting, as part of the whole exploration, getting to know you, deciding are we going to do this or not. The state management team met with us, and we met with the stakeholder group, but we had no idea that they don't meet very often as a management team. So once or twice a year, maybe 3 times a year, the state management team gets together. Well, part of our deal is that we're there every month, and we get 1 hour on their agenda for that whole policy, practice to policy feedback loop. And so they were not available, and we tried this, we tried that, and finally we talked to our funders at the U.S. Department of Education and said, we're just wasting our time and we're annoying the heck out of them by persistently going back and insisting on the same things over and over again, and we would like to stop. And they said, well, okay, but they said this is the first time in their knowledge that any of their funded TA centers has ever fired a state. So they said, well, fired, it's not fired. I mean, it's a mutual agreement. Just like we had a mutual agreement to start, we have a mutual agreement to stop. But they was kind of like, well, it's unheard of, but go ahead. So yes, ma'am.
In terms of those states, are you talking what they're scaling up? Are they scaling up positive behavior support? Are they scaling up both academic and behavior stuff? What is it?
Keep going.
So they're doing both?
There was a fantasy that was held by some folks in the beginning that each state would have a thing that they would be doing. So they would choose literacy, okay. And the whole state then, all the districts, all the schools, I mean, this would be everywhere. And that was our charge then, was to go do this. As soon as we spent like 3 months in these states, we went back and talked to our funders and said, this is a losing strategy, because not everybody has the same need within a state. And to try to force feed things that people don't want or need at a district level or a school level makes no sense at all. I mean, it violates the basic premise of implementation. The whole exploration stage is there to find out what is the need, and it's going to really drive change in that district. So, okay, fine. So now we, at the district level though, we do ask, what is the first thing, not the only thing, but what is the first thing that you want to do and do well in every school? And you want to see every child benefit from this one thing that you want to start with. Then we'll move to the second, the third, the 10th, the 20th. But we have to do one thing well. If we can't do one thing well, we can't do anything well. So no way to get 10 things done well simultaneously if we can't even do one thing by itself. So but that's a hard pill to swallow because they want to do a lot of stuff. And we say, do a lot of stuff. Whatever you're going to do before we arrive, do it. Do it that way. But for this one thing, this is where we're going to build capacity. And so PBIS, literacy, RTI, school dropout prevention, what's another? Oh, another one has put together their common principles of effective practice, CPEP, yes. So they kind of have an amalgamation of 3 or 4 or 5 things that they have come to, very much though to change instructional behavior of teachers to benefit a whole lot of things. So they're looking at high levels of engagement of students, so you get to teach students to respond a lot to things, gives you lots of opportunities then to provide positive and corrective feedback. So that's their kind of thing. It doesn't matter if you're teaching math, if they're teaching literacy, if you're teaching whatever. It's this engagement, and the high rates of this is what they're really going for in their CPEP thing. And so, but it's nicely defined. We can develop some fidelity assessments for it and so forth.
Have you had an issue with, so where we've struggled is two places. One is providing professional development for folks everybody wants to be doing something different. And 2 is the evaluation piece of that. How do we actually, the fidelity part, the outcomes, if everybody's doing something different and our funding agency is asking for an aggregate report?
Now, what I was describing is a district decision. So within the district, though, all schools then are going to do CPAP, for example. All schools are going to do literacy or PBIS or whatever it is that they have chosen. So that the whole point of this is to build the district capacity to do things well, with fidelity, with good outcomes in all schools. And so this is the pick one, and we're going to do it well, help you do it well in all schools, all classrooms, all children. And so so there, in that district, you would know fidelity and you would know outcomes. And so from an evaluation point of view for that district, you would have some pretty clear, you would know what it is, how they're doing it, and what they're accomplishing. Now you could go to the next district, it would be something different, but done equally well across all schools, all children, all, et cetera. So, I mean, I know where you're coming from, because from like we keep coming at this both from a practice point of view. So we have to do what makes sense to get the job done. We want these kids educated. Now the other part of us, we're the research evaluators, and we're saying, well, how in the heck are you going to evaluate that? When you're doing all those things.
And the professional development piece is huge. I mean,
Yeah.
when you've got
Yeah.
districts wanting to do 3 different things, that's.
But this is where the implementation part of this, and we're doing the same thing with a major national initiative now in child welfare. Implementation, though, is going to look the same across all of these. So whether they're doing PBIS, they're doing literacy, they're doing CPAP, they're doing dropout, they're doing whatever it is that they have chosen, there still are the best practices for training, the best practices for coaching, the best practices for fidelity. A, have one, and B, meet these criteria. What does it look like in terms of how the school has changed its administrative practices to really support whatever it is they've chosen to do? But all schools now have to change that way in order to support this intervention being done well. What does the leadership part of this look like? How well are they doing and shifting from kind of the more technical to the more difficult adaptive kind of issues that arise? So those are the things where we have common measures that go across schools, districts, and regional implementation teams. If you're an implementation team, all of these things apply. So the generality there, that's where you're going to find the common themes. What they apply the implementation expertise to is what the variation. But here again, whatever they've chosen, they're chosen to do district-wide. So all schools, all kids, all teachers. So that simplifies that part to a degree. But the implementation part, common measures, the other part, you could rely on the fact that there's going to be a fidelity assessment done well, and that they're going to have some proximal outcome measures that are built into this, because that's part of the improvement cycles that goes on in every school and every district. Yes.
Twofold question. When you're talking from this morning, when you said all schools, every child, you also talked about taking, when district is the point of entry, but you take 3 to 4 to 5 schools in a district initially, not all 60 schools.
Yes.
Am I understanding that correctly?
Yep.
Okay.
There's a one of the things that we have borrowed from our folks who do work in like the World Health Organization, the World Bank, some of the big businesses that have tried to change their way of work while they're doing the work, which is where we are in education. I mean, one of the things we talked about this morning is that we're trying to build the new while we're still running everything that's there. So there's this thing called a transformation zone. And you will read about that in some of our stuff. But that's where you start out, not with, if you try to start with everything, you're dead in the water. I mean, they will defeat you in about 2 months. But if you start out with, and this is why I was saying, we start out with 3 districts, and within 3 districts, we start out with 2, 3, 4 schools, 3 typically. But that's our transformation zone. And that's where we can figure out what the systemic issues are, what the district issues are, what the school issues are. What does it take to support teachers actually doing this new work? But as soon as you have enough And it doesn't take a lot to convince you, okay, we've got most of this figured out, now let's go to the next 3 schools in the district. Now let's go to the next 3 districts with 3 schools in them. So you start this mitosis process. So, but just like mitosis in anything, you have to make sure that you have all of the DNA strands. You're not divvying that out. You have to replicate that for mitosis. I have to